fact, if you learn what good fats are and you adopt a lifestyle of low carbohydrate, high fat, but you eat natural fats from meats and avocado and butter and coconut that have been very gently, if at all, processed, and they are either saturated or monounsaturated. Now they're a very, very safe and healthy fuel. And together with this, we have something called ketones and autophagy. So if you do low carb, high fat, if you do fasting and intermittent fasting, now you start developing ketones and a process called autophagy. And I've talked a lot about these in different videos, but real quick, these have anti-inflammatory signaling properties. So they will reverse the effects, all the deleterious effects of metabolic syndrome, of insulin resistance, of type 2 diabetes. When you have enough ketones and you develop enough autophagy, you will quickly reverse that process. Autophagy is a little bit more difficult because it's more of a gradual process, but a good rule of thumb, a good landmark is to use something called a GKI ratio. It'll give you a good indication. And if you look at your glucose in terms of millimoles, so if you fast and you get your glucose down to about 3 to 4 millimoles per liter, which is about the same as 54 to 72 milligrams per deciliter, and then you also measure your ketones and you find those to be in the range of 3 to 4 millimoles, because that's the unit you will get. So you measure your glucose. If you have milligrams, you convert it to millimoles. You divide the glucose by the ketones. And if that ratio comes up anywhere around 1 or close to it, now you know that you have a very profound fasting effect and you're making a lot of ketones and you're getting a lot of autophagy. And typically if you do some fasting, it'll take 2, 3, 4 days to get the GKI ratio into this range. And there are several studies that show that you can shrink tumors and you can prevent cancer. You can reverse these conditions to some degree by getting into this state, by getting enough autophagy going.